am Nicole De Paula, and founder and executive director of the Women Leaders for Planetary Health. We have a very special guest today, but before presenting you, so I would just like to say that I am speaking from Germany, where we are hosted by the Institute for Advanced Sustainability Studies here in Potsdam. So on behalf of our team, I welcome you to the session, the 25th Vision of Living in Harmony with Nature, Opportunities for a Path to Recovery by 2030. So this is a conversation with a very special guest, the Executive Secretary of the UN Convention of Biological Diversity, CBD to make it shorter. So Ms. Elizabeth Mrema, very welcome. So I don't need to introduce you in detail, but I just want to highlight some of your, I know you're very committed to the cause of gender empowerment, and just the fact you were here today, it's early for you, and in a very busy week for the UN and everything you do. So I think that's a very concrete proof that you're a very strong advocate for this cause. So to give you a better idea of her vast experience in multilateral level, before joining the CBD, you were at the UN Environment Program, the UNEP, for over 2 decades, where you were the director of Law Division. You had several important roles there. For example, you were the deputy director of the Ecosystems Division. Even before UNEP, you were the executive secretary of the Convention of the Conservation of Migratory Species of Wild Animals, the CMS, in 2009, 2012. So your work at UNEP has focused really on development, implementation, and enforcement of environmental law, including multilateral environmental agreements at the national, regional, and international levels. So I definitely would like to invite you, Elizabeth, to be with us to provide these opening remarks so we can start a conversation about the importance of living in harmony with nature, especially in times of COVID. As you know, many of you have attended our sessions before. I will give the floor to Ms. Mrema for 10 minutes. And then we hope to have a little bit of time for a dialogue. And please don't forget to include your questions at the Q&A box. Feel free to, don't wait for the end of this presentation, I would call, to put your questions here, and we hope to have a very productive dialogue. So I'll pass over to you, Elizabeth. Thank you so much for being with us.
Thank you very much, Nicole. Let me begin first for thanking you to invite me in this coffee break dialogue. Indeed, as a woman, it's an important dialogue also for me, and especially the topic you want me to dwell into, to dive in, is very important for women. And here, when I mention women, I'm particularly more concerned by those women in the villages of Africa, the villages of Latin America, not the villages of Canada and US. Those are different. And the challenges, the situations are always, of course, different. But let me be more systematic in my conversation. And I'll begin with looking at the connection links between biodiversity, human health, and the COVID situation we are in. So just to begin with, I think it's important for us all to remind ourselves that, and I think it's obvious or common knowledge, that biodiversity supports human health in many ways. It provides us the goods and services that really sustained by a well-functioning ecosystem. Food security depends on biodiversity of the surrounding environment. That's where we get our access to clean and safe water, again supported by biodiversity. Increased forest areas significantly improve water flow regulation by reducing runoffs and providing that greater water storage. The water we drink, the water we cook with. Water is life. There's nothing we can do today without water. And all that then depends also on that protective biodiversity. In addition to its direct effects on health, we know biodiversity is equally integral to key development sectors that modulate health outcomes directly or indirectly. And here look at forest, fisheries, agriculture, tourism. And when we look at tourism, about 1.5 billion people literally depend on tourism on their livelihood, or on these also different sectors. So clearly, human health is intimately connected with the health of the planet. And how we manage it is how then we'll manage the life-sustaining resources that biodiversity and ecosystems provide. There is a rapidly growing body of scientific evidence that suggests COVID-19, just like other strains of coronavirus. We can all recall the MERS, the Middle East virus, the SARS, the Ebola, the HIV. All these are zoonotic in origin. Zoonotic in the sense that they originate in the, from animals, spilling over to human population, and from human then to human transmission through trade and tourism. And statistics are very clear now that 75% of all emerging infectious diseases come from wildlife, 60% of which are zoonotic. So clearly, that's not a small percentage, which we should not ignore. Human activities, including changes to land use, changes to sea use, how we manage our agricultural and food production systems, all have been responsible for the emergence of these zoonotic diseases or zoonotic pathogens. And many of the underlying drivers of disease emergencies cut across a large range of environmentally and social destructive practices, amplifying that disease risk time and time again. We know the impacts of large-scale deforestation, habitat conversion and fragmentation, agricultural and land intensification, the way we produce, trade and regulated species, or species, how they are used as food, referring to wild meat and the like. We know what we get from, with regards to medicine. The entire regulation of hunting of wild animals and plant species, both of which animals and species are at the brink of extinction. Climate change has not saved us. So these and all other significant drivers of biodiversity loss do drive that potential for new diseases to emerge and spread. And this is where then we end up with all zoonotic or vector-borne diseases. If we look at devastating Ebola virus outbreak in West and Central Africa way back 2014, scientific evidence clearly suggests that the outbreak were primarily connected then with hotspots of forest fragmentation, and were closely linked to the areas in which recent deforestation events had taken place. Coronavirus, we know why it began. Again, wild animals, again, as the result of encroachment into the wild forested areas. And that's the spillover. Trade moved the virus from China to other parts of the world, and we're all currently locked down as the result. So again, the impacts of the importance or the connection between biodiversity and COVID, our relationship between human activities and nature and health cannot be underestimated. And we've all seen it now with our naked eyes. Moving from that, let me look then at the impacts of biodiversity loss and the COVID-19 on the health, particularly of women and girls. The impact of environmental degradation and biodiversity loss, particularly on health outcomes, unfortunately, most significantly or the most affected end up being to be the vulnerable populations. And these are particularly those resilient, those populations which rely on natural resources and are less covered or protected by the social protection mechanisms such as healthy coverage. And these vulnerable groups, this is where we find our children, the women, the indigenous populations, and those highly dependent on biodiversity and ecosystems for their daily subsistence survival, and these are mostly subsistence farmers. Similarly, we know COVID-19 is equally proving to have a disproportionate effect on vulnerable groups, particularly women and girls and those indigenous population. Many factors add to women's health risks related to pandemic, directly and indirectly, as they're causing that further biodiversity loss. You know, most women, particularly in the developing world, these are the unpaid care and domestic work. That's where their livelihood is, and that increasingly then have increased as the result of the pandemic. Being home, doing all the work, children, families, feeding them, and all that. We also know, again, look at the women, the healthcare workers. These majority have been the frontliners in the face of the pandemic, and virtually then clearly have increased risk of exposure to the virus. Studies by the UN Women, clearly UN Women is telling us women spend 3 times as many hours as men each day in unpaid care and domestic work. And COVID-19 is even adding more to women's unpaid care workloads. Among infected healthcare workers in 5 countries where they've studied, 17% were women. So when we talk of frontliner healthcare, over 70% are women. And equally then we can say these 70%, over 70%, look at the risk impact exposed to these women. As the result of the pandemic, obviously, we will be expected to see the first rise in global poverty since 1998. The pandemic obviously will push more women and girls below the poverty line, reversing the decades of progress to eradicate extreme poverty. So even where progress had been made, then that progress has really been pushed back as the result of the pandemic. By next year, 2021, it is expected that about 435 million women and girls will be living in less than $1.9 a day. And this will include 47 million pushed into extreme poverty as the result of COVID-19. So conditions of poverty exacerbation health risks and the increase of the dependence of women and children on biodiversity and natural resources, particularly in cases where they rely on these resources to meet their basic needs, such as food, water, their livelihood, then will be further exacerbated into increasing the biodiversity loss. Last year, the Food and Agriculture Organization report on the state of the world biodiversity for food and agriculture outlines how biodiversity contributes in various ways to human nutrition and hence the health and capacity to work. So locally adapted species, varieties, and breed of crops and livestock, trees or fish can be less demanding in terms of labor than raising the exotic counterparts. These labor savings characteristics can make locally adapted genetic resources particularly important for women who are often overburdened with child rearing and other domestic activities. When we look globally, biodiversity contributes to over 80% of agricultural and food production. But we also know that biodiversity contributes to the same agricultural food production globally is declining and putting food security and nutrition equally at risk. And again, according to a recent report by the UN Women, women around the world are at 27% higher risk than men are facing severe food insecurity. And this gender gap is expected to even rise more as the result of the pandemic. Because of long-standing agricultural gender inequality, women farmers are particularly at risk of hunger, especially when any sort of crisis strike. On average, rural women account for nearly half the agricultural workforce in developing countries. And they face multiple barriers, including discrimination, lack of land rights, limited access to productive resources, exclusion from decision-making and political representation. That is still a challenge to many women in many societies. And within the household, these, again, the women in taking care of their families are the ones, many cases, tend to frequently eat less. They are the last one to eat. And of course, eat when they are so tired, when everybody has gone to sleep, and virtually not eating. And if the food is finished, then they are the ones even more suffering. So food security programs are lacking in such sex disaggregated data. So it's times very difficult to even track whether such development assistance literally reaching women farmers in many parts of the world. Gender-based violence has increased as the result of the isolation and stress stemming from this pandemic. Such violence are likely and closely, of course, associated with the use of natural resources, wherein environmental degradation, resource scarcity will further amplify the gender-based violence as a means of maintaining control and existing power imbalances. So you can see again the challenges the women and children face in a number of societies. Are the solutions available to help them? I don't know. But the pandemic tells us that we cannot continue the business as usual. Neither can we return to the normal of yesterday. We need to now establish a new normal, the normal that will enable us to live in harmony with nature. And to do so, then this will involve stopping such environmentally destructive practices and fully recognize that biodiversity is indeed a foundation of human health and a foundational pillar of social and ecological resilience, including for gender equality and women empowerment. We need to better manage the ecosystems to reduce the risks of infectious diseases, including zoonotic and vector-borne diseases. For example, doing so by avoiding ecosystem degradation, and avoiding ecosystem degradation include deforestation, intensification of agriculture and livestock, reducing human encroachment on natural habitats, reducing overexploitation of resource extraction, reducing and preventing invasive alien species, limiting and controlling human and wildlife contact. For us at the Secretariat of the CBD, we are moving into now ongoing debates for the development of the next 10 years global framework for biodiversity. or the post-2020 Global Biodiversity Framework, which we hope will also play a significant role in building the resilience we need in the face of the growing environmental, health, and development challenges. It is in an unprecedented opportunity that we all need to ensure greater alignment and policy coherence across the sustainable development commitments, including the 2030 Agenda and its sustainable development goals, which emphasize on the critical interlinkages with gender equality, women empowerment in achieving our shared objectives. So we need to ensure that women are at the decision-making table when it comes to developing solutions to building back better and to determining how biodiversity and natural resource use can be managed. Diverse perspectives and skills, of course, are needed to take us forward towards a healthier future for the planet and for all the people, to be able to enable us to reach our long-term vision of the 2050 vision of living in harmony with nature, which says biodiversity at that time will need to be valued, conserved, restored, and wisely or sustainably used, while maintaining ecosystem services and sustaining a healthy planet and delivering those benefits essential for all people. And here I underline all people, which includes women, children, and vulnerable groups being at the forefront. As many of you on this chat, you might be aware, this week, basically yesterday, the whole day yesterday, world leaders met to share their commitment, actions, approaches to address biodiversity crisis at the UN Biodiversity Summit held yesterday. And the leaders have met to demonstrate their political will and leadership to accelerate. No, in fact, leaders are meeting today, if I'm not wrong, to accelerate the implementation of the Beijing Platform for Action. So again, we can see the alignment there. The need to halt biodiversity loss and the need to achieve gender equality are two interlinked objectives. Action for biodiversity cannot be effective without the equal involvement, engagement, and contribution of women and girls. And gender equality is therefore dependent on healthy ecosystems to ensure a foundation for a sustainable and equitable future is maintained. The future we want, the future we'll all be delighted to see ahead of us. So for us at the Secretariat, we are all committed to continuing to improve their awareness, their understanding, and the capacity to address the gender perspectives in actions to conserve, sustainably use, and ensure the sharing of the benefits of biodiversity are guaranteed. We are compiling a transformative and innovative best practices for gender and biodiversity to help guide actions in the post-2020 period, and have to begin the process to prepare. We've begun to begin the process to prepare our draft gender plan of action to align with the post-2020 Global Biodiversity Framework. Together with our Chinese government, we will be the host of our next conference of the parties. We are also planning to put a spotlight on gender and biodiversity issues at our next conference of the parties, to be able to make the link between advancing action on biodiversity and the implementation of the Beijing Platform for Action. So of course, we will be looking at you women leaders to also join us on this train moving to Kunming, China, as we prepare this and ensuring what the role of the women and girls in the Beijing Platform for Action also align with the gender equity in the post-2020 Global Biodiversity Framework. And the two then are connected and strengthened in our action plan, our gender action plan, which will be now contributing, or the role of gender in the implementation of post-2020 Global Biodiversity Framework when it is adopted. Maybe I stop here.
Yes, thank you
for now.
Thank you. We have very few minutes too, because I really don't want to disrespect your time. And I think your presentation covered many of the questions that I also wanted to ask you in terms of, you gave this overview of this week was a very important week for, biodiversity. So you touched on that, and specifically bringing this linkage between, if you don't have women leaders at the table and helping to construct those decisions, we're not going to have, a healthy environment, and we're not going to have healthy people with, yes. Not safe environments. So this is, I think right now is very clear, and perhaps COVID-19 in that sense can be perceived at least as a stronger wake-up call for our global leaders. We really don't have time to address questions in general, but I think because you're mentioning the importance of this platform, for example, is really bringing people together to understand this linkage between gender empowerment, healthy environment, for healthy people. So just because we don't have a lot of time, and I wanted to also get from your personal experience, how did you, we are about to launch a mentorship program focusing in the Global South. As you mentioned at your beginning, at the beginning of your speech, you said you're very worried about other regions. It's not the rural areas, for example, of Canada and other developed countries. So it's very important that we include everyone. It's a very inclusive approach to protected biodiversity. It's because it's about people and nature. And I think that's what the concept of planetary health brings to the table. So could you share with us some of your, maybe a personal story that you had? Did you have a mentor in your career? How did you navigate in terms of what kind of skills do we need now to build for this very uncertain world that we're having now? And COVID is just exacerbating everything. So you are a women leader for planetary health. And if you could give any advice for, the people who are listening us, they will probably watch this video later on our YouTube channel. That will be a very concluding, I think, remark for people who may be looking for inspiration, because just to conclude a thought, you mentioned, we know that biodiversity and the targets that we have, we are not on track with the IG targets. So we need to, and the Beijing platform that we're celebrating today, we're also no country on earth has achieved everything that was supposed to be, achieved. So the scenario is pretty, it's gloomy a little bit. So in this week, you also heard some potentially, I think we can close with what you heard this week that can also, in terms from new leaders taking, a step further and committing to biodiversity. And then from your personal story, how do you, would encourage people to take either research that is policy oriented and want to connect these two worlds of science and policymakers, for example?
2 points. In terms of women being able to participate in decision making, the women need the enabling environment. And that enabling environment, it means we still need the governments to create that enabling environment, to put the policies in place, which then will enable the women to participate in the negotiations, or even the women to be appointed in the different positions. So we still need the government. And when many governments are still male dominated, again, we need the women to make the noise, to be heard. Otherwise, if we continue cultural, many women were timid, then we will remain there. So we need to make the noise, insist to be heard, to push and get that space, so that then the governments will be able to give that space and create that enabling environment. 1, 2, for many developing countries, especially countries, cultures where I come from in Africa, there are traditions. And we know how difficult it takes to change some traditions. And again, traditions are made by human beings and practice. So the people to change, again, it's us. For many cultures in Africa, for instance, women are not able to inherit property or land, things like that. But we also know many women now, or the girl child, have gone to school and have been empowered. So these are the ones, again, to put that pressure. And also the men of today are not the men of my father and grandparents who had never gone to school, and therefore their lives were guided by the culture. So again, women have to make the noise.
I guess this is a perfect phrase to close this meeting, because we are really 2 minutes late now, and we are so thankful for your speech, for your powerful, encouragement. Now that yes, women, let's make some noise. Let's ensure that these important issues are taken into account, especially in what we're calling now this green recovery, because it has to be a fair recovery. So thank you so much, Elizabeth, for being with us. We'll be in touch. Please subscribe to our channels. You can watch this video again there. And we hope to see you soon in the next coffee break. Thank you so much.
Thank you.
Thank you.
Have a good day.
Bye-bye. Bye, everyone.